briefing about COVID-19 in London and Middlesex County with London Mayor Ed Holder and the Middlesex-London Medical Officer of Health and CEO, Dr. Chris Mackie. We want to welcome the media who are joining us today and remind you to submit your questions in the question forum here on Microsoft Teams, indicating your media outlet and your name. And we'd also like to welcome those tuning in this afternoon on Rogers Television, the Rogers YouTube channel, as well as the Rogers Facebook page. Also, listeners who are listening on Global News Radio, AM 980 CFPL, and those watching on the CTV London website. Let's get right to our opening remarks and then to your questions, and we'll start with Mayor Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. I'm pleased to say that despite the challenges associated with COVID-19, the City of London has opened 2 cooling centres today to provide London's most vulnerable with relief from the heat. I'll chat more about the cooling centres in a moment, but in addition, a number of community agencies have stepped up, working together to support those accessing their services during this particular weather. First, the city's coordinated informed response program is offering refreshments and snacks as needed. London Cares has increased its outreach presence in the core, offering water to people in the downtown. And YOU, at Loza, the Arc, and My Sister's Place are all providing services for up to 5 people at a time, along with water and snacks. As for the 2 City of London cooling centres, we have one located at the Canada Games Aquatic Centre on Wonderland Road North, and another at the South London Community Centre. They're open from 11 a.m. this morning until 7 p.m. tonight, as well as tomorrow. In addition to an indoor cooling space, we're also providing water to those who visit. And in so doing, we're continuing to follow the provincial and local health guidelines and appropriate measures which are in place to prevent the spread of COVID-19. I was quite pleased to see the quick response and level of collaboration from our administrative staff and outside agencies to ensure that London's most vulnerable are being supported through this heat wave. Together, we share a deep commitment to keeping Londoners safe during these extraordinary times. One other update to share: later this afternoon, about an hour from now, London Transit General Manager Kelly Pelechny will be speaking to the Federal Finance Committee in Ottawa on behalf of transit systems in mid-sized cities. As I've been saying for the better part of 4 weeks, cities across Canada, including London, absolutely need the federal and provincial governments to come to the table. The need for emergency operating support is more urgent than ever, and that's part of why Kelly's appearance before the Finance Committee today is so very timely. Where the LTC is concerned, we've been losing so much revenue that money from tax assessment, growth, and reserve funds used to cover the shortfall to this point will run out in just a few weeks. The London Transit Commission, public transit, is an absolutely vital service, and among other things, is critically important when it comes to getting our frontline healthcare heroes to and from work, as well as our essential frontline individuals to and from work. If the LTC service suffers, our ability to respond to COVID-19 suffers. It's plain, simple, and that clear. Look, I've had conversations with federal ministers. I've had conversation with provincial ministers. I've had conversations with local MPs and local MPPs. And the time for talk is over. We need action. We need funding. And frankly, we need it now. There can be no economic recovery without city services that include transit, but it also includes community infrastructure and direct supports for the most vulnerable dealing with COVID-19. You know, London has deferred over $130 million worth of property taxes and wastewater fees to provide relief for Londoners. We have looked at staffing and made considerable reductions as ways to balance and deal with the financial pending issues that are absolutely in front of us. We're facing $33 million in non-recoverable losses by August 2020, and we're doing all we can. Plainly speaking, we need the federal government and the provincial government to step up now. Dr. Mackie.
Thanks very much, Mr. Mayor. So first of all, to the numbers, 4 cases and 1 death reported yesterday in the London and Middlesex area. Provincially, we actually saw a significant decline in cases yesterday, even though tests went up slightly. Provincially, the numbers were 287. So only the second time under 300 in well over a month. Again, we don't want to take too much comfort from one day's data. We'll keep watching that closely. The other good news that we have today was that in this area anyways, Londoners and residents of Middlesex really took up the Premier's request to get tested. Yesterday at the assessment centres, we saw a combined 537 people come to Carling Heights and the Oak Ridge Arena. That's the highest number we've ever had at our two assessment centres. The previous high was about 500, and that was on day 2 of operation when just Oak Ridge was online. So lots of demand there. If you recall yesterday, someone on the call did ask about the impact of the Premier's comments, and we can now confirm without a doubt that the Premier's comments and your help in the media to promote testing really made a difference, and we saw a big jump. So thank you to the Premier, thank you to all of you who have helped get the message out that testing is now available for anybody that needs it at our two assessment centres. Once again, if you need those hours of operation, Oak Ridge Arena is open Monday to Friday, 11 a.m. to 7 p.m. Carling Heights Optimus Center is open all week, 7 days a week, again, 11 a.m. to 7 p.m. I'm going to pause there. Happy to take any questions.
All right. Thank you very much, Dr. Mackie. Thank you, Mayor Holder. We do have a bunch of questions lined up, so let's get to them right away. The first question is for both of you gentlemen, and it's from Steve Young at CTV News. Will the health unit be working with both the city and other local organizations to ensure safety for those opening day camps? Does the health unit have any recommendations for these organizations as they work on figuring out summer day camps? Dr. Mackie, why don't we start with you?
Sure thing. So the question about day camps opening safely, really important question. We know that children can be, although not the most vulnerable, they can be the ones that spread this illness and potentially bring it home to those who are more vulnerable. And that day camps will be necessary as we, continue to move on with opening our society and trying to live somewhat normal lives in the new context of coronavirus. So absolutely, the health unit will be working with day camps. Essentially at the moment, what we're doing is a request-based process whereby day camps or others who have the need for public health support and guidance can reach out to us through our hotline or through our generic COVID inbox. The hotline again is 519-663-5317, and the email is covid@mlhu.on.ca. That's COVID@mlhu.on.ca. There is also some work happening at the provincial level that will establish some of the best practices. There may not be mandated requirements as we've seen in healthcare, but some of the best practices. And we've also done that work locally and working with other health units to make sure that we can all provide guidance that's as soundly grounded in research and evidence as possible.
All right. Thank you, Dr. Mackie. And Mr. Mayor, did you have anything to add there?
Well, absolutely. And I appreciate the question, Steve, because it was just last week when I convened a meeting with day camp operators to get a sense of what they felt the issues were and what their concerns were. Certainly what I heard was an absolute focus on the customers, the clients, the kids of day camps, that their safety was a paramount concern, and issues that they would have to deal with the different types of camps that were put in that exist in our city. That issues around distancing, issues around health, and the appropriate types of steps one needs to take. I thought that they acted incredibly responsibly, and they looked to the support of the health unit for advice as well. And that certainly was part of the discussion that we had. The other concern that was expressed was how willing parents might be to have children participate in these day camps. And that was one of the things from the standpoint of putting on services, what kind of response might they get from parents on behalf of their children, parents who are obviously concerned. So there are a number of factors. Certainly the health of the kids, health of the employees, issues around physical distancing, issues around parents' comfort level, issues around the guidelines and rules where they work with the medical officer of health's team and the unit's team to be able to ensure that the rules are in place to give parents confidence. So do I think there will be camps? That question was asked recently. The answer is yes. In terms of form and function, as far as numbers, I think that'll be one of the issues. What is off the table at this point, certainly, is the issue around overnight camps and overnight stays. That will not be one of the considerations at this time.
All right. Thank you very much, Mr. Mayor. The next question, Mayor Holder, is also for you. It comes once again from Steve Young. With cooling centers now open, how are you ensuring that proper distancing is being carried out?
Well, Steve, what we have is we have pretty experienced staff in our coordinated informed response teams, London Cares teams, and also the experience as well that the agencies that are providing services in the form of food and snacks, what they've been doing over the last 2+ months is that they've been very mindful in practicing self-distancing and safe physical distancing as they deal with individuals with needs. So as we have mentioned, there will be certain places. I've mentioned YOU at Losa, the Arc, my sister's place, that will be providing services for up to 5 people at a time. And as you know, that is the current crowd limit that are being allowed. As far as the 2 centers that have been opened up, one in the Canada Games Aquatic Centre and the second in the South London Community Centre again, physical distancing and limiting crowds in, but making sure that people have a place to go to get out of this heat. We wouldn't have said this a few days ago, but obviously the heat has driven the rationale for why we're doing what we're doing. It makes sense. We've been able, as of this morning, to be able to have the logistics put in place to make sure that we take care of not only the needs of the individuals and their safety, but also the staff and volunteers who are taking care of these individuals as well.
All right. Thanks very much, Mr. Mayor. Dr. Mackie, the next question is for you. It also comes from Steve Young. Dr. Mackie, there have been lineups at the Carling Heights Assessment Center following the Premier suggesting people can simply show up and get tested. How do you manage expectations in terms of when people should get tested?
I mean, it's great that people have stepped up and taken up the call to get tested, and I'm much happier seeing lineups there, frankly, than empty lines. And the fact that people in this area realize that they have a role to play in addressing this pandemic by coming forward and getting tested, it's actually a huge benefit to our fight against this pandemic. So I'm pretty happy from that perspective. I take the point that we do need to manage people's expectations in terms of timing. In the past, we've had no wait times, and certainly that's the expectation that people have now had at those assessment centers. And it is likely now that there will be some time to wait, but we're still able to process those folks quite quickly. Most people come through the site with a wait time under 20 minutes, which, if you compare to what that might be if you went to an emergency department to try and get the test done, it compares pretty favorably. So hopefully people understand that in the context of a pandemic, the system's doing everything possible to create an efficient and effective service, and people are able to get their care in a way that meets their needs as well. I would say that in general, coming earlier has been more timely, so that, if you're thinking of delaying your visit to the assessment center to later in the day, best to come closer to the opening hours of 11 a.m.
All right. Another question, Dr. Mackie, for you. This one is from Paul Vanderhoven at the London Free Press. Dr. Mackie, are you concerned about reports of people gathering outside in larger numbers? For example, the tweet about seeing lots of kids at neighbor's pool. Are people starting to ignore the guidelines?
This is a concern, and we are hearing reports of people gathering in backyards, pools. There were some reports over the weekend around Harris Park, although certainly nothing like what you saw in Trinity Bellwood in Toronto. But so this will make a difference. That's all I can really say. If people are able to keep their distance and minimize those social interactions, if they absolutely have to do it in as safe a way as possible. And, there currently are not good guidelines to keep children safe playing in pools. The pool water is not an issue. Pool water, as long as it's properly maintained, will kill the virus. But it's just very difficult to maintain physical distancing with children in a pool environment.
Absolutely. Dr. Mackie, another question for you. This one coming from Jennifer Beeman at the London Free Press. Dr. Mackie, how many COVID-19 tests are being done in Middlesex and London daily? How many people are coming to and being tested at the assessment centres each day on average? And I know you had some numbers before. It's going to be kind of a strange average at this point.
Yeah. The numbers really have changed, so we're watching them day to day, and that's, so I'll give you a full history. We opened, there were over 200 tests the first day. The next day, with, again, just one site open when it was Oak Ridge Arena, the number of tests was around 500. And then they trended down from there. Even once we opened up Carling Heights as a second center, the average declined down to around 200 and then dropped off. And that was in part because when we first opened, we didn't have enough swabs to test everybody. And so we were very selective about who we could swab in those assessment centers, and people felt that there was limited reason to attend. And then when we solved the swab issue and the testing capacity was stronger across the province, we promoted and media helped promote that it was time to get tested again. And so the numbers went up from low around 150 down up to about 200, 250, and then they trended downward again until this past weekend. And this past weekend, with the Premier's comments over the weekend that everyone could get tested who needed it, that's really driven those numbers back up. So we're now, yesterday, over 500 and what was it, 37 was the total. In terms of the number of tests being done, not all of the people who are attending have requested and have been tested. It's about 350 of those 500, that's not an exact figure, but it's in that range, who did receive testing yesterday. It looks like we're on track for significant days again today at both centers, probably not quite hitting the numbers that we hit yesterday, but certainly I would think over 200 at each assessment center today.
All right, and Jen does have a follow-up, Dr. Mackie, and this gets down to some of the granularity of the issue. As the province tries to encourage more people to get tested, are enough of those people in London and Middlesex County coming forward? Does the health unit have a target for the number of tests it wants to complete each day?
So if we look at the capacity for those assessment centers, we're pretty close to at capacity. So something in the 400 or 500 tests a day is definitely adequate in terms of and basically meets the capacity in terms of what we're able to test in the area. In terms of there are different values of testing different people. Testing asymptomatic people, so people that don't have symptoms, that testing is available for those who are concerned that they were in contact with someone with COVID, but it's not the highest yield. When you're testing people that don't have symptoms, it's somewhere in the 2 in 1,000 people that will test positive. That would be the numbers from the long-term care testing that we did of all patients in long-term care. 2 in 1,000 were testing positive if they didn't have symptoms, whereas the number is more like 5 to 10% if it is somebody that does have symptoms would come back positive. So it's much higher yield if the person tests positive. If the person does have symptoms. It's much higher yield if they have been in contact with somebody that has confirmed coronavirus. So those are the people that we absolutely need to have come forward and get tested. If you have symptoms or if you have been in contact with somebody with coronavirus, those are the ones we absolutely need to please come forward and get tested.
All right, Dr. Mackie, thank you. Mayor Holder, a question for you from Leanie Lambrink at CBC London. Mayor Holder, why didn't the cooling centers open yesterday?
The ability to open up cooling centers is something that literally from a logistics standpoint takes a certain amount of time because it requires staffing that isn't currently in place to be able to do that. And it was important that we ensure that there would be a safe facility for Londoners who have those requirements to be able to go. And so this was all about the logistics of putting it together. You know, it's interesting. I look at today, like at this very minute, it's 30 degrees, but actually it feels more like 39 when the humidex is factored in. And so we're very mindful. So the issue yesterday had everything to do with logistics, which we have resolved. We put them in place, and that's why we're good to go today.
Thank you, Mr. Mayor. Dr. Mackie, a question from Leanie Lambrink for you from CBC London. There has been a single death reported the past 3 days. Do you have any insight into that 3-day trend?
Well, yeah. I mean, it's great to see the number of deaths declining locally. Today, we also saw a decline in the number of deaths provincially as well, so that's encouraging too. That's what we're all really trying to avoid, right? And so if we are able to massively increase testing and we identify more of those mild cases, that's actually great. If we could see the number of cases go up because testing is happening more frequently, but not see the number of deaths go up, that would be ideal. It means we're getting on top of the pandemic and it's having less of an impact on those most vulnerable populations that are at highest risk. I think the other part of the death count is that there has been a tremendous effort to reduce risk in those highest risk settings, both long-term care and retirement homes, in terms of making sure the homes can run as effectively as possible, and making sure that they have personal protective equipment, making sure that everybody who needs testing in those homes gets testing, and that in situations where you have, staffing issues, whether it's because some staff are sick with COVID or other reasons, that the hospitals and the whole healthcare system is able to wrap around those high-risk settings. And so that's part of the reason why you're seeing the death count come down, because there's such work happening in those high-risk settings.
Thank you very much, Dr. Mackie. The next question comes from Casey Taylor at Easy 101 Country 107 Radio. And this question may be for Mayor Holder. Long-term care is obviously the big story today provincially. Absolutely horrific reports coming from homes where the military has been brought in. These reports have come in from all 5 homes where soldiers have been deployed. Do you share concerns many may now be feeling that similar conditions could be present here in London? And what do you have to say to people who, quite understandably, are shocked by what has come to light today?
As we know, the long-term care facilities that we're talking about are in a jurisdiction outside of Middlesex County. And it was very specifically targeted to those areas because there was a need initially related to staffing, and the military, to their credit, stepped up and were directed to provide the kind of medical supports that were necessary for those facilities. And I think through that process, as I understand, they determined that there were a number of issues. Of course, anybody who has any humanity is concerned about the kinds of findings that have been presented by them. And I think as a result of the Premier determining that more information is going to be required as this pandemic works itself through, to put more attention to long-term care facilities, I think that's prudent, and I think it is wise. As far as London is concerned, the military have not been called in to deal with any long-term care facilities, either in London nor in Middlesex County. Nor do I anticipate actually that will be required. Having said it, I think our priority always and must be the care of the individuals, both in terms of the residents as well as the staff who are looking after those people. It can happen anywhere, I'm sure. But I would tell you that right now, with the information that I have at my disposal, that is the kinds of issues as illustrated and declared as tragic as they are, I'm not aware that they're present in any of our facilities in Middlesex County.
All right. Thank you very much, Mr. Mayor.
Mr. Mayor, I would confirm that public health has been working with all of the homes in the region, long-term care and retirement homes. We're also involved in meetings daily with the healthcare partners, hospitals, family doctors, long-term care homes, retirement homes, and others that are specifically to try and identify those issues in the homes, bring them forward, and get them solved before they become a problem for any of the residents living there. And there are a small number of homes that we're watching closely in the region. Over the last few weeks, it's been in the 2 to 3 homes range out of 30 or 40 long-term care retirement homes across Middlesex and London. But those homes are very open to working with partners. All of them have had reviews of their infection prevention and control practices and regular checkups to make sure that they're able to implement best practices. All of them have stable personal protective equipment supply chains in place in partnership with hospitals and the rest of the healthcare system. And staffing concerns are being addressed as they come up. And actually, I want to give huge credit to our hospital partners, London Health Sciences Centre and St. Joseph's in particular, who have been willing to provide staffing support for homes whenever that has been needed. That's a major asset to the system. And from my perspective, somewhat outside of the healthcare system, it's actually incredibly positive to see the system working as a system.
Thank you very much, Dr. Mackie and Mayor Holder. Dr. Mackie, next question is for you. Lainey Lambrink at CBC London has it. Dr. Mackie, do you have any message for people who test negative for COVID-19? Do you have concerns about people developing a false sense of security?
Yeah, thanks for asking. It's really important that people understand, and we do counsel them on this when they come for testing. It's important that people understand that a negative test is only valid at the time of the test. So if you come on with no symptoms and you test negative, it's entirely possible that you might develop symptoms the next day, and that negative test is no longer valid. You might have to come back and get tested. So the best time, the most likely time to detect coronavirus, if you're going to be developing the illness, is about 24 to 48 hours after symptoms begin. If you haven't waited for at least a day after symptoms, then it's possible that you have a false negative and then go on to develop the illness that just hadn't been the virus hadn't been replicating enough to test positive in the individual being tested yet. And I mean, it's also possible that the other risk around testing people that don't have symptoms is a false positive. And so we saw some of this in long-term care homes and retirement homes where, the new provincial definition means one positive case declares an outbreak. And so even if 1 in 1,000 tests is a false positive, it can have impacts on the whole system as that home gets shut down.
All right. Thank you very much for that explanation, Dr. Mackie. I think that does it for the questions. We're just about out of time. There was one more in the queue, but it's a question we've already answered around the increased number of people visiting testing centers compared to last week. So for that person, you can, if you missed that part of the briefing, you can go back to the recording that will be posted later today for that response. Gentlemen, that's a half hour. We're out of time and we're done on questions. So thank you once again for being part of this discussion. Lots of news to share today, and we thank you for bringing it to our listeners and to the media. We'll see you again tomorrow for our next virtual media briefing on COVID-19, Wednesday at 2 o'clock. So long.